Hey, Dr. Tyler Williams here to answer your questions today about avoiding a root canal. Root is one of those four-letter words in dentistry or in healthcare that often terrifies or scares a lot of people, and that may be you. So we'll share some ways you can avoid root canals, some things we've been able to do to cut down dramatically on the number of root canals. Very few and infrequent now with some of the newer technologies, and also my own experience with the root canal. But if you have an urgent need where you're in pain or you're looking for a second opinion on a root canal, don't hesitate to reach out to us. You can call the number or you can click on our website and book a consultation with one of our team members, and we'll be happy to go through the pros and cons of some options you have and see what may be best for you moving forward to keep your mouth healthy and be able to avoid a root canal. So there are two main ways that people develop root canals. One is from mouth disease, and the other one is from trauma. So mouth disease can be anything from gum disease, cavities, gingivitis, an accident where you got hit in the face, cracked your tooth, maybe some dry mouth that over time has caused your teeth to crumble, or medical treatments, medications. Those can be really hard on teeth. So that's where you have a scientific change, a biologic change in your mouth, and it goes at the expense of your tooth. So it eats away at your tooth, causes holes to grow in your tooth. And that hole, the bigger it gets, it's full of millions and millions of bacteria, eats away into your tooth until it gets into the nerve. And then you can get a dead tooth that can be painful, or sometimes they're not painful at all. But essentially what happens is your tooth is filling up with necrotic, kind of like gangrene, dead bacteria that expands and it pressurizes, and then it can really start to hurt. Or sometimes there's no pain at all until some people wake up with a big swollen face. The other way is from trauma, and trauma would be induced from a procedure. So when we used to do a lot of crowns, dental crowns, it would cause some trauma to the tooth. So you have to drill and grind and shave a tooth down to this small shape, but you get closer to the nerve when you're drilling down on the tooth. So between those two things, sometimes that needs a root canal. It can be caused by one or both of those, right? So if you have a broken tooth or a cracked tooth or a big hole in it, decay, and you go see a dentist, they may suggest a crown. They're going to grind all that out, plus more of your tooth to be able to fit a crown over it so you can bite on it. That's going to cause trauma to the nerve. So when that happens, typically anywhere from 1 in 3 to 1 in 5 teeth would end up needing a root canal. And not to mention, it never sat right with me that we were sacrificing all this tooth just to fit a cap over it when we didn't need to sacrifice all of that tooth. So a similar example is if you needed a knee replacement, but the surgeon told you that in order to get that knee in there, they actually were going to have to take your thigh and your thigh bone and most of your leg bone to fit that knee on. That would seem kind of like overkill because you're now sacrificing parts of your body that were in good shape. That's kind of what happens when you have a typical crown fitted over your tooth. Even if it's a newer ceramic crown, it's still the same process. So 30, 40 years ago, that was the best technology because we didn't have advanced bonding. But now with biomimetic treatment, you can avoid that. So we kind of look at this as 3 separate R's. And for more information on this, we have a book that explains these in detail. You can reach out to us below, and or with your consultation, you get a copy of one of those books. And they'll explain this. It's a consumer's guide on your options for avoiding a root canal. But these 3 R's are renew, refresh, and replace. So refresh is the first one. That is your preventative care. That is getting your teeth checked up, clean, maintain x-rays every 6 months. For some people, every 3 or 4. If you have gingivitis or gum disease, maybe more frequently. This also would include whitening, sealants, desensitizers, things that don't permanently change your tooth or your mouth, but they give your mouth new health, new life. And by doing that, that's your best weapon against avoiding a root canal 90% more of the time. Keep up on that. So I've had one root canal, and this was probably 11, 12 years ago. And I had a tooth that years back had some work done, and then I had an old filling worked on, and it was drilled a little bit of aggressively, kind of an old school style where you would put a big filling in the tooth, kind of like a silver filling, even though it was white. It wasn't done with a biomimetic approach. It was done more with drilling. And about 6 or 8 weeks later, the tooth started to throb and ache. And I knew what that meant because I was a licensed dentist at that point. And so I had a root canal done and everything went fine. I still have the tooth. However, I would have rather avoided that because the tooth's different. Once you've had a root canal, the tooth's dead, doesn't have life in it. And many of those root canals do well for a long time, but the best root canal is the one you never had. So in that process, I started to figure out that I didn't feel good about grinding teeth down. So we learned how to do an overlay procedure, which is nicer to your tooth. And in my experience, if I were to treat 20 different teeth on 20 different people, anywhere from 3 to 10 of those are going to end up needing a root canal sometime in the next few months or the year. With this biomimetic overlay, my experience is maybe 1 out of 20, sometimes less, would need any type of root or nerve treatment. And that's typically happens only when there was so much damage pre-existing to the tooth. By the time we got in there, that little bit of irritation or instrumenting or shaping your tooth caused a flare-up and that nerve died. But it can be very frustrating, especially if you weren't having any pain before that. So your refresh is your best bet against root canals and other problems. Your next one is renew. Renewing is when you have your tooth rebuilt to look natural or sometimes even better, whiter, brighter. That's where we use bonding and ceramic and overlays and biomimetic treatment, but not crowns and fillings, right? So it's important to make that distinction between those two. And that's renewing your teeth. That's getting them back or better to a healthy state. And then the third one would be replace. So you have refresh, kind of your preventative edge. Renewing is rebuilding, regenerating your teeth. And then replacing is if a tooth's so badly broken or missing, you would have it replaced with something like an implant, maybe some type of bridge or removable appliance that's cosmetic. But typically it would be an implant, and that's going to provide you with function and stability and a long-term smile. A lot of people that we see, we're doing a combination of all three of these R's. So we might be renewing a lot of teeth, refreshing others, getting the gums healthy, doing some whitening. And then also if a tooth's broken or cracked or can't be saved, we would replace that tooth. And that gets you into a healthier place in life. So if you have some further questions, please reach out. Hope this has been helpful. We have other videos that talk more about avoiding crowns because crowns can often lead to root canals. It gives you some more insight on newer and better ways that are available to you so you can still keep your smile nice and healthy and get the bad bacteria out of your mouth and avoid cracked teeth without having to have old school crowns and posts and pins and root canals put in your teeth. So thanks for watching, and we'll catch you on the next one. Have a great day.